Hi, my name is Mayeli Mendez, and today I will be talking about the Unit 10, Unit 13. Primary Care. The National Health Service. The National Health Service (NHS) is responsible to real care to everyone in the UK. Although a small number thought to pay to private care treatment in the future is a description shared to drugs and appliances to a cervical collar with exceptions for same patients such as children and the elderly. Primary care is provided by general practitioner or GP. Sometimes now is a family doctors, a nurse, dentist, pharmacists, and opticians. GPS work in practice of 1 to 10 or 20 practice for based in surgery and look after health people in the local community. They also provide health education in areas such as smoking and diet. Run clinics give vacations, for example, for example, for influenza and may perform minor surgery such as removal of warts and moles. If a patient needs specialist care, the GP will make a refer the patients to a consultant in secondary care. Patients are normally seen on an appointment basis. Home visits are made when patients are housebound, unable to leave their homes, or too ill to attend surgery, of hours OOH treatment from 6 p.m. to 8 a.m. is provided to be the local primary care church with organized series of GPS and local GP to carry if someone is absent. No, the non-surgery has three meaning. The building their GP work, the practice has moved to new surgery of the High Street. At time the GPC patients morning surgery from 8:30 to 12:30. The worst the surgeons, the patient needs urgent surgery and a boost appendix. The practice team. A typical GP practice employing sections that are responsible for initial patients contact, make appointments, talking requests, re- re- repeat repressions, prescriptions, taking medicines from patients at other health care providers for filling and scanning documents into patient records. The practice manager has responsibility for finance and sometimes for it supervise receptionist staff here's local and help prepare the practice development plan. Practice nurse. Run asthma, diabetes, and cardiovascular disease clinic as well as on clinics for two house with the to give up smoking. In addition to practice staff, GPS work with a number of health professional district nurse. Visit a temporary husband pensions recently discharged hospital pensions to share this crime, such as ulcer to stream. Health visit families to carry out check-ups on young children, particularly under 5, to make sure they are healthy. Special attention is paid to families in need such as those living in poverty. They also do heavy immunizations. Midwives run clinics for antenatal patients, physiotherapists provide hands-on treatment, but also teach patients exercise they can do to improve their condition after an accident or operation. A UP day. Our steward works in a practice in a small market town with three other family doctors. Their surgery in the center of the town is charged by three practice. This is a typical working morning when she is not the duty doctor responsible for exercise urgent problems. Atención primaria. En el Servicio Nacional de la Salud. El Servicio Nacional de la Salud es responsable de la atención médica para todos los de Reino Unido. Aunque un pequeño número opta por pagar atención privada, el tratamiento es gratuito, pero hay un cargo de prescripción de medicamentos y aparatos, como un collarín cervical, como excepciones con algunos pacientes, niños y ancianos. La atención primaria está cargada de médicos generales o médicos de cabecera, a veces conocidos como médicos de familia, enfermeras, dentistas, farmacéuticos y ópticos. Los médicos de cabecera trabajan en práctica de 1 a 10. Las prácticas se basan en una cirugía y cuidan a la salud de 1.000 a 15.000 personas en su comunidad local. También brinda educación sobre la salud de las áreas como el tabaquismo y la dieta. Los pacientes normalmente se ven una cita previa. Las visitas domiciliarias se realizan cuando los pacientes están confinados, no pueden salir de sus hogares o están demasiado enfermos para salir de la realidad del tratamiento, fuera de horario de atención de OOH, de 6 de la noche a 8 de la mañana. La brinda la Private Care Trust Local, que organiza turnos de médicos generales y médicos suplentes que para cubrir si falta alguien. Nota: el sustantivo cirugía tiene tres significados. El edificio donde trabajan los médicos de cabecera. La práctica se ha trasladado a su nueva consulta en la High Street. En el momento, los médicos de cabecera ven a los pacientes. La cirugía matutina de 8:30 a 12:30. Las, las visitadores sanitarios los porteros administran clínicos de pacientes de peritonitis. Los fisioterapeutas brindan tratamientos básicos, pero también enseñan a los pacientes ejercicios que pueden ser para mejorar su estado después de un accidente u operación. El día del médico de cabecera. El doctor Stewart trabaja en un consultorio de un pequeño pueblo comercial, en otros 3 médicos de familia. La consulta se encuentra en el centro del pueblo y es compartida por 3 consultorios. Esta es una típica mañana de trabajo en la que no es solo un médico de guardia responsable de emergencia y problemas urgentes. 8 a.m. llegar a cirugía. Después verifica la impresión de correo electrónico, comprobar si hay mensajes urgentes y no urgentes, revisar los correos electrónicos de la Junta de la Salud y los socios, prepararse para la cirugía. eh, prepararse para la cirugía, cirugía materna, 7 a 10 minutos, reservados de la semana pasada, 2 reservados con 48 horas de instalación, 4 reservables en el día de consultar la recepción para mensajes, firmar las recetas y ocuparse de las pausas para el café con recetas repetidas de una sala de conferencias con los colegas, verificar si las citas y visitas domiciliadas, dividir las citas con C e ir a casa, visitar casas. Exercise 10.1. Complete the sentence. Look at A opposite to help you. Children over 60 people with home clinic decides to have to play the description chart in the United Kingdom. Patients with mobility problems made it unable to go out there are housebound. The average GP appointment in 10 minutes long. A low GP is someone who takes the place of a staff member who is a leave a current site co-working where is a known as out of hours treatment. Make word combination using a word phrase from each box. One word can be used twins look at A and B opposite to help you. Change the string, make appointments, make home visit, perform minor surgery a patient, room a clinic, supervise staff, take message. With member of the practice 10 would be responsible for each of follow. Look at be opposite to help you. Running a clinic for pregnant women, midwives, teaching a patient how to strain working leg, physiotherapists, letting the GP know that a patient can come her appointment receptionist. Running a clinic for people who want to lose weight, practice nurse. Visiting patients who have just returned home after a hernia operation. District nurse. Carrying out check-ups of children in a poor neighborhood. Health visitors. Organize cover for a absent doctor. Practice manager. Complete the diary for the third stewards after look at A and C opposite to help you. Process 10 meeting over sandwich lunch after surgery. 12 10-minute appointments. Coffee break check with reception informations, deal with home visit, and repeat prescription requests. Paperwork refers to secondary care admin tax, telephone calls to patients, private medical examination, and phone switches to OOH service. Medical Education 1. Medical Education in the United Kingdom. Medical in the United Kingdom covers undergrad education from the 5 years of the medical school, the sessions of an university responsible for medical education. A 2 years foundation program which provides training for new doctors of after graduate through a series of plans in the different specialties. Postgrad training with doctors take a become GPS or consul senior specialist. As the letter to college for different specialties. For example, the Royal College of Physicians, continuing professional development in the front the courses and seminars, with doctors undertake throughout their working life to keep updated. Extract from an undergrad prospectus. The MBCHB Bachelor of Medicine, Bachelor of Surgery is a 5 years undergrad medical degree course. Most of your learning takes place in small groups. The main components are core years, the 1 and 3 are integrated program on clinic and scientific topics. Main present our problems-based learning (PBL), where you work with others on a series of class problems. Student select modules. Student select modules CCMS, SSMCS allow to choose from menu of subjects such as sport medicine, or even studying a language as preparation for overseas, elective and hospital attachment of your own choice between years 4 and 5. Vocational students and clinical skills. This companion prepare for you for the clinical skills required for contact with patients for year 1 of your course through periods of practical training where you are attached to hospital department are general practice. Clinical attachments years 4 and 5. A series of, of 4 week clinical attachments in medicine, surgery, physiological medicine, child health, obstetrics, gynecology, and general practice. A student's view. Ellen, a medical student, describes her course. I'm just finishing my first year on medicine. What I like about this course is that you're involved with patients at the very beginning. Even if our first year we spend time in hospital. Most of the course PVL, we have 2 year sessions a week where work in group in 8 to 10 solving clinical problems. We decide together who to take the problem, look at books, only sources, make more notes, and discuss the case together. Is great way are learning and reading to know the other students. In the past, medical students had lectures with the whole class taking notes from lectures from 9 and 5, but now is mainly group growth. Although we do have some lectures and manners we where we work in small groups with a tutor. I like all of it, even the decisions we get cook up cadavers from the second month on the course. La educación médica 1. La educación médica en el Reino Unido cubre la educación de pregrado, 4 o 5 años en la escuela de medicina, la sección de la universidad es responsable de la educación médica, un programa básico de 2 años que brinda la capacitación para nuevos médicos después de graduación a través de una serie de prácticas de diferentes especialidades de posgrado que los médicos toman para convertirse en médicos generales o consultantes especialistas, a menudo entregados a través de los colegios para diferentes especialidades, por ejemplo, el Royal College of Physicians. Desarrollo profesional continuo en forma de cursos y seminarios que los médicos realizan a lo largo de su vida laboral para mantenerse actualizados. Extracto de un protesto programa. El MBCHB, que es la licenciatura de medicina y la licenciatura de cirugía, es un curso de pregrado en una medicina de 5 años. La mejor parte de su aprendizaje se lleva a cabo en los grupos pequeños. Sus componentes principales son básicos de 1 a 3 años, que es un programa integrado de temas clínicos y científicos presentados principalmente a través de aprendizajes basados en problemas de PBL, donde trabaja con otros en una serie de problemas de casos. Módulos seleccionados por estudiantes. Los módulos seleccionados por estudiantes, SSM, por sus siglas en inglés, le permite elegir entre el menú de las materiales como medicina deportiva o incluso estudiar un idioma para preparación para la materia óptima en el extranjero. Un archivo adjunto al hospital de su elección entre 4 y 5. También están los estudios vocacionales y habilidades clínicas. Este componente lo prepara para las habilidades clínicas requeridas para el contacto de pacientes desde el año 1 de su curso, a través de las prioridades de la capacitación práctica, donde está adscrito a un departamento hospitalario o práctica general, adjuntos clínicos de 4 a 5 años, una serie de adjuntos clínicos que de 4 semanas en medicina, cirugía, medicina y psicología, salud infantil, obstetricia, ginecología y medicina general. La vista de un estudiante. Alien, un estudiante de medicina, describe su curso. Estoy terminando mi primer año de medicina. Lo que me gusta de este curso es que te involucras con los pacientes desde el principio. Incluso en nuestro primer año pasamos tiempo en el hospital. En gran parte del curso de PBL tenemos 2 sesiones de 2 horas a la semana donde trabajamos en grupos de 8 a 10 resolviendo problemas clínicos. Decidimos juntos cómo abordar el problema. Buscamos libros y fuentes en línea, tomamos notas y discutimos el caso juntos, y una gran manera de aprender y conocer de otros estudiantes. En el pasado los estudiantes de medicina tenían de aprender y conocer a los otros estudiantes. En el pasado, tenían conferencias con toda la clase tomando notas de los profesores de 8 de la mañana a 5 de la tarde, pero ahora es principalmente trabajo en grupo, aunque tenemos muchas conferencias y seminarios donde trabajamos en pequeños grupos con un tutor. Me gusta todo, incluso la decisión llegamos a descuartizar cadáveres a partir de segundos del segundo mes del curso. Exercise 11.1. Match 10 activities to a stage of official medical education in the United Kingdom. Give the A opposite. The sitting cadavers undergrade. Keeping on a log surgical products observed to perform postgrad. Working for 4 months in accident and emergency to experience the specialty. Foundation program. Taking 4-week attachment in obstetrics and gynecology, undergrad. Taking an only course on recent development in cardiovascular disease, continuum professional development. Complete the sentence. Look B and C opposite to help. I use before their final year, students have the chance to take an elective in a hospital of they choose anywhere in the world. Problem based learning contrasts with a approach where each subject is taught separately. These lectures are often interactive with regular opportunities for the students to ask questions. In clinical skills, students learn how to treat and manage patients. Students select modules can be topic from one such as medicine, such as foreign language. Dissections of cadavers. In an important part of the anatomy component, the medical school of the University of Edinburgh is on the oldest in the United Kingdom. She is a consultant, the on Royal on the leading pediatric health specialist in the country. The Royal College of Surgeons is Edinburgh desk from 50:05. We have a seminars each week where we discuss topics in a small group with our lecturer. Match each of these activities to one of the components of the undergrad course describing B and C opposite. 1. Julie spent 6 weeks working in a small hospital in the Himalayas, overseas. A group of students discussed together the possible reason for abdominal pain after meals in a observed 44-year-old male problem-based learning PBL. A small group of students traced a pulmonary artery in a cadaver dissection. Otto spent a month working in the pediatric ward on the local hospital clinical attachment. Learns how to take blood from an elderly patient clinical skills. You might choose to study travel medicine in his fourth year. Students select mode. Medical education too. The foundation program is a 2-year training program which from the bridge between university level study and medical school and especially or general practice training. It consists of a series of placements, each lasting 4 months, which allow the junior doctor known as a training to sample different specialties to, for example, pediatrics, a year on training FJ1 correspond to pre-registration house office PRHO, post a year to train to senior office spouse. Each training has an educational supervisor who ensures to that senior doctors deliver training in different ways, including clinical and educational supervision. To progress, tenants have to demonstrate a range of clinical conventions which are assessed through conversation at their workplace. People in medical education, tutor, and academic on the same case of postgraduate student who leads tutors. Demonstrator is anatomy teaching somehow who demonstrate who to dissect, demonstrate Often postgraduate students paying their way through medical school, lecture or senior lecture, an academy with teaching and research responsibility who contributes to teaching of the particular discipline. Professor, a senior academy with teaching and research responsibility for a particular discipline, usually a leading figure in the discipline. College tutor, a, a consultant responsible for delivering a college training program. Clinic trainer, a consultant assigned to training to provide training during period of direct clinical care. Educational supervisor, a consultant who supervises a training period of training. Medical qualifications. BMS, BMSC, BMEDSCE. Bachelor of Medical Science, a degree often taken after 3 years of medical student by students who may wish to follow a career medical reach. MBC, HB, MBBS, MB, MBCH, BMBS. Bachelor of Medicine, Bachelor of Surgery. Bachelor degree or undergrad degree, this first degree for United Kingdom. Doctors. MD and DM. Doctors of Medicine. DRCOG. Diploma of the Royal College of Obstetrics and Gynecology. MRCP. MRCS. Member of the Royal College of Physicians. Of member of the Royal College of Surgeons. Doctor. Become members by successful completing the assignments produced in the college. FRCS, FRCS-ED, FRCS Glass, FRCESA, follow on the Royal College of Surgeons of England. Other colleges are integrated by the letters we follow, for example, Edinburgh, Glasgow, or Ireland. How doctors become a fellow depends on their college. For the FRCS, further examination must the passed for other college is the domination award assessment. Educación médica 2. El programa de la Fundación, el programa básico, es un programa de la capacitación de 2 años que constituye el puente entre los estudiantes de nivel universitario en la escuela médica y en la capacitación especializada o en la práctica general. Consiste en una serie de estancias de 4 meses de duración de cada una que permiten al médico junior conocido como entrenador probar diferentes especialidades como pediatría, un aprendiz del año FY1 que corresponde a los puestos oficiales a causa del registro PRHO y el aprendiz del año 2 a los puestos oficial de superior de casa SHU. Cada alumno tiene un supervisor educativo que se asegura de que los médicos más experimentados brinden capacitaciones de diferentes maneras, incluida la supervisión clínica y educativa. Para progresar, los alumnos deben demostrar una serie de competencias clínicas que se evalúan a través de la observación en su lugar de trabajo. Personas en educación médica. tutor, un académico o algunos de los casos estudiantes de posgrado que que dirige las tutorías. El demostrador, una manera de enseñar la anatomía, alguien se demuestra cómo diseccionar los manifestantes suelen ser estudiantes de posgrado que pagan sus estudios en la Facultad de Medicina, profesor o profesor titular. El estudiante con responsabilidad de docencia e investigación que atribuye a la enseñanza de una disciplina particular. Está el profesor, un académico senior que con responsabilidades docentes y de investigación para una disciplina en particular suele ser una figura destacada en una disciplina. Profesor universitario, un consultor responsable de impartir una información universitaria programada. Entrenador clínico, el consultor asignado a un aprendiz que brinda la capacitación durante periodos de atención de clínica directa. Supervisor educativo, un consultor que supervisa el periodo de formación de un aprendiz. Em, Cualificaciones médicas. BMSC. Licenciado en ciencias médicas, un título que a menudo obtienen los estudiantes que desean seguir una carrera de investigación médica después de 3 años de estudios médicos. También está la licenciado en medicina, licenciado en cirugía. Los títulos de licenciatura son el primer título para médicos de Reino Unido, el doctor de medicina, diploma Royal College o de obstetricia y ginecología, miembro real Colegio de Médicos o miembro real del Colegio de Cirujanos. Los médicos se convierten en miembros contemplar con éxito los procedimientos de evaluación en el colegio, miembro Royal College de England. Otras universidades se indican con las que siguen, por ejemplo, en Edimburgo, Glasgow y Irlanda. La forma en la que los médicos se convierten becarios depende de su universidad. Para el FRCS se deben de aprobar exámenes adicionales para otros colegios en nominación o evolución de trabajo. Complete the phrases with the verbs of the both. The phrases can be completed in two different ways, with two A and B opposite to help you. Assess, deliver, demonstrate, improve, surprise, and take. Demonstrate a competence or who to do something. Supervise in training by ensuring she successfully complete her training. Deliver a course of training program as a teacher. Take a course of training program as a student. Assess progress of completion. Match the two parts of the sentence. Look at A and B and C opposite to help you. And F, J1 is a doctor in the first year of the foundation program. A demonstrator is an anatomy teacher who teaches dissections. A clinical training is a consultant who provides training during periods of the theory clinical care. A supervisor is a consultant responsible for the training program of a trainee. A medical school is part of the university responsible for medical education. A medical a placement is a period spent after training in a hospital or its general practice. A college is a body of specialists responsible for delivering assessment training in their specialty. A fellow is a specialist who has researched to highest level in their specialty. While the qualification of the other on surgeons look at see opposite to her. Mr. A. H. John Husband, MBCHB, FRCS, FRCSA, I. Bachelor of Medicine, Bachelor of Surgery, Fellow of the Royal College of Surgeons of England, Fellow of the Royal. To Dr. C. Dole, B.M.E.D. S.C.I.A. D.M.R.M.R.C.P. Bachelor of Medical Science, Doctor of Medicine, Bachelor of the Royal of Surgeon College of Bachelor. Miss E. English, MBBS, FRCS. France, Bachelor of Medicine, Bachelor of Surgery Fellow on the Royal College of Surgeons. Dr. E. Murray Wheeler, BM, MD, and FRCP. Bachelor of Medicine, Doctor of Medicine Fellow on the Royal College of Physicians. The overseas doctor types of registrations. To may of treat patients in United Kingdom, a doctor must register with the General Medical Council (GMC). There are several types of registration. Provisional registration is for doctors who have just qualified from medical school in the United Kingdom and from certain European economy area member states. Full registration is for doctors who have completed their year's clinical training. Limited registration is for international medical graduates who have not completed the equivalent for clinical training in the United Kingdom. Specialty registration is for doctors who have completed specialty medical training and have a certificate of completing a training CCT. The GP register is registered of the TUS LP to work in general practice in the NHS. Note for the full details on the general and the general medical council the lab before they can obtain full registration. Some categories of overseas doctor are required to take to professional linguist assessment board. PLAB. The PLAB is designed to ensure those have passed a practice safely at the level of SHO is a free appointment in United Kingdom hospital. Part 1 consists of a reading test and knowledge skill of attitudes. Part 2 in the objects clinical examination is a consists of 17 5 minutes clinical scenarios now as stations to asthma professional case. Lab stations advice. As also assess the skill clinical examination for ability for to carry out the physical examination of the simulated patients. Actor training to play this role will be asked uncomfortable or intimate examination will be carried out using a mannequin anatomical model. Particular skill You will be asked to practical skills such as suturing, giving intravenous injections, communication skill, your ability to interact with a simulate patients, or in same case, the examiner will be asked skill tests may include reading bad news and giving advice of lifestyle history taking. Your ability to take an accurate history and make a reasoned diagnosis will be assessment, advice, and decision from the successful candidate. Read the instructions outside each station. Careful, can you have 1 minute for this? Keep in mind stiff precautions like throwing the sharp in the sharp pin. Don't forget to ABC airways, breathing and circulation protocol in very emergency station. So the patient understands what is happening, then ask they about the any concerns they may have. Don't just give a lecture, listen careful to what the doctor says. El médico extranjero, tipo de registro. Para gestionar y tratar a los pacientes en el Reino Unido, todos los médicos deben registrarse en el Consejo Médico General, GMC. Hay varios tipos de registro. La inscripción provisional era para los médicos que acaban de graduarse en la Escuela de Medicina en el Reino Unido de dos ciertos Estados miembros en el espacio económico de Europea a Estados Unidos. La inscripción completa era para médicos que han completado un año de capacitación clínica. El registro de especialista era para médicos que han completado la formación médica especializada y tienen un certificado de finalización de la formación CTT. El registro GP es un registro que todos los elegibles para trabajar en la práctica general de NHS. Nota, para tener más detalles, antes de que puedan tener un registro completo, algunas categorías de médicos extranjeros deben de realizar la prueba de Junta de Evaluación Provisional y Lingüística, que es el CLAP. Está diseñado para garantizar que quienes aprueben pueden practicar de manera segura a nivel de la SHO en la primera cita en un hospital. Estaciones, lab y consejos. OCES evalúa estas habilidades. La exploración clínica. Se evaluará su capacidad para realizar una exploración física en un paciente simulado. Un actor estrenado para desempeñar este papel. Los exámenes incómodos e íntimos se realizarán utilizando un maniquí, un método anatómico. Habilidades prácticas se le evaluará en habilidades prácticas como suturar y administrar inyecciones intravenosas. Habilidades de comunicación se evaluará su capacidad para interactuar con un paciente simulado o en algunos casos con un examinador. Las habilidades evaluadas pueden incluir de malas noticias y dar consejos sobre el estilo de vida. Evaluar de la historia clínica se evaluará una capacidad para evaluar la historia precisa y realizar un diagnóstico razonado. Lea los consejos sobre las estaciones de un candidato son los siguientes. Tenga en cuenta las precauciones de seguridad, como tirar los objetos punzantes en el contenedor de los objetos punzantes. Nota, los objetos cortantes son agujas, cuchillos que deben de deshacerse de forma segura en un contenedor especial llamado contenedor de agentes pulsantes. No olvides el protocolo ABC, vías aéreas, respiración y circulación en cada estación de emergencia. Verifique que el paciente comprende lo que está sucediendo. Luego pregúntele acerca de cualquier inquietud que pueda tener. No se limite a dar una conferencia, escucha atentamente lo que dice el actor. Exercise 3.1. What kind of registered mind to this doctor obtain? Look at A opposite to help you. A Newland qualified Spanish doctor. Provisional registration. A Newland qualified Nigerian doctor. Limited registration. A doctor who has successfully completed the first foundation year full registration. And CHO who has successfully completed the foundation program and gained a certificate and completing training after several specialist post-specialist registration. While the operations in words look at A and B or C and BOC opposite to help you. Any doctor who was to work in the United Kingdom must register with the GMC General Medical Council. Some other doctors must pass the lab test before they can register professional and linguistic assessments. Part 2 of the test consists the objective and structured clinical examination. In any emergency, remember the ABC protocol: airways, breathing, and circulation. Before can obtain a specialist registration, you must have a CCT certificate of completion of training. My name is Musa and I have from Gem. I come to United Kingdom about years yes and about 2 years ago after graduation because Gem is onside the EEA. I could only obtain limited registration. With BGMC at first it was very difficult for me to obtain a place and foundation program. Although I speak good English, I have to take lab tests that showed that I could work safely. I owe United Kingdom. I have to give some advice to other candidates. I would be that the at concert station should you shouldn't simply memorize of the first in the better for uh, really think about what you're saying to the actor and get the annotation right. After completing my year clinical training, I was able to obtain full registration, but I found it difficult to get to SHO post in my chosen especially pediatrics hospital now had to demonstrate there is suitable conduct from the EEA. Once I've completed the second foundation years, I should retain a CCT which will allow to produce to completing of training with the GMC, an important step of the road to become pediatric consultant.